Okay, today we've got a 32-year-old male interested in eliminating the pain, upper left quadrant. If you'll notice on tooth number 16, that's 2-8. There's a large carious lesion on the mesial. He was not interested in extracting 17, 3-8 along with that. So we went ahead and took on the case to get him out of pain. And we're getting ready to get started here. He's anesthetized, and we'll go ahead and get in. Now, anytime you are extracting a maxillary third molar, the best way to gain access is to have the patient close together. Now, you could gain a little more access here if you used a Minnesota retractor. I didn't think it was necessary. I could see the tooth, fairly conical shaped root. So what am I doing right now? I'm using a Woodson WDS1. You'll find this instrument in the composite plastic section of the dental catalogs. You won't find it in surgicals. I'm using an American Dental Accessories 301 elevator. If you haven't contacted American Dental Accessories, a great little company up in Minneapolis. Do a lot of good stuff and are really customer oriented. I really like those guys. Anyway, so you see the 301. I've already got the tooth basically out, and I noticed that there's some tissue still holding the tooth in place. So instead of just cowboying that rascal out of there, I'll go back with that Woodson and see if I can sever the tissue loose that's holding that tooth in place. Once again, it's just one of those things that we could be done right now, and the patient spends another week healing because we tore the tissue unnecessarily. So basically, we're going to look up and make sure that we don't have a sinus exposure, make sure that we've gotten everything out of there, see if there's any loose tissue that needs to be managed. I've got a curette in there and looking around, checking to see if there are any loose fragments of bone or whatever. A little irrigation. I use normal saline. It's isotonic. You can use sterile water or Paradex. Paradex is expensive. Normal saline, I like it because, like I said, it is isotonic. Obviously, there's a little piece of tissue that I would like to get out of there. I think that if you go in and remove granulation tissue and anything that doesn't need to be there, it will not impede the healing process. And it's all about healing. You take care of your patients; they're going to come back, and when the next treatment is necessary, they'll tell their friends, etc., etc. So, anyway, I'm going through. A lot of people would already be done by now, and I'm just taking a little bit of extra time to try to clean up the area. I think the difference between somebody that's Dr. Yankum down the street and a true exodontist is somebody that's going to take the extra care and try to do the best they possibly can for the patient. And it's not all about speed. It's about efficiency and getting in and getting cleaned up. So if you might be able to see up there now, I'm not sure if you can see in the mirror, but there's not a whole lot of bleeding. There's not a lot of tearing of the tissue. It looks pretty clean up there. That's what I strive for, is the least traumatic as possible. I'll go ahead and squeeze the buccal plate together a little bit to try to reposition it, so in the event the fellow ever needs a denture or a partial or something, he doesn't have a big undercut of bone that has to the prosthesis has to go across. One of the most important things you should always do, and I recommend this as the doctor, to look to make sure that you have all the tooth. Don't leave that to your dental assistant.